Hello everyone, and how are you? So let's discuss the quiz video questions that I gave you yesterday, in which I said, can you diagnose this pelvic mass? 99% get it wrong. So I want you to listen very carefully as we dissect each question. Don't miss any part of this, because it's going to help you improve your vocabulary of pelvic pathologies. So this is our first question here. You can see there's some free fluid there, which are elongated. This is anechoic free fluid there, and this is uterus there. So you can see the free fluid again there, and then the uterus there. That's your ovary there, the ovary appear normal. There is also a pocket of free fluid there, which is also elongated. So this is in keeping with Hydrosalpinx. So this is bilateral Hydrosalpinx. So if you were thinking about Hydrosalpinx, you are very much 100% correct. So what is Hydrosalpinx? Hydrosalpinx is fluid collection in the fallopian tubes. So when fluid collects in different areas in the body, it has got different names. If the water collects in the head, it's called hydrocephalus. If it collects in the lungs, in the pleural space, it's called a pleural effusion. If it collects around the heart, it's what we call the pericardial effusion. If the fluid is in the abdomen, the peritoneum, we call that ascites. If fluid is collecting in the kidneys, is hydronephrosis. Then if this fluid now is collecting in the fallopian tubes, we call it hydrosalpinx. Mostly hydrosalpinx uh, develop as a sequel to an inflammatory process on this inflammation of the fallopian tubes. That's where we see it as inflammatory exudate. So question number 2, you can see we have an ovary here there, and you can see here there are multiple septated cysts there, and you can't see or the stroma of the ovary. It's very difficult for you to differentiate the stroma from the rest of the ovary. So this is the morphology of a thicker lutein cyst. So that's the morphology of thicker lutein cyst. So these thicker lutein cysts, they normally exist due to a surge in beta ACG that mostly happen with molar pregnancies. So those patients with molar pregnancies are the ones which mostly develop these thicker lutein cysts. Question number 3. So there you see we've got a huge mass there, and then you can see there's some more blood flow on power Doppler there, and you can see there's some solid components there, but they are sedimenting by gravity, because you can differentiate the mass from the fluids on ultrasound. So that demarcation tells us that there is some debris which are inside. It's not entirely a solid mass, so there's free fluid and some debris which are inside, and there are also pockets where we do have with blood that is flowing on our Doppler. So, ladies and gentlemen, this is in keeping with a malignant transformation. So, this is a mucinous cyst adenocarcinoma. So, a mucinous cyst adenoma is a benign lesion. So, there are no cancerous transformations. But here now, because we are seeing intralesional perfusion, so that is the configuration or the morphology of a malignant transformation. So it is in keeping with mucinous cyst adenocarcinoma. So now let's go to question number 4. So you see here, there's this lesion there that you're seeing there. You can see here, you can see this is very echogenic, and then there's a cystic portion, and you see there's posterior acoustic enhancement there. So this lesion, then, ladies and gentlemen, is in keeping with a dermoid cyst. So this is a rocking tusked nodule, and you can see the tip of the iceberg sign there, acoustic shadow, distal acoustic shadow in there, and then this is the rocking tusk nodule. So we say that a dermoid cyst can have any components, be it the teeth, be it hair, fat. So it can have anything. So this is a dermoid cyst. It's a rocking tusk nodule. Question number 5. So you see here we've got our uterus there. You can see there's a lesion there that is very hyperechoic. That is very hyperechoic there. It's in fact echogenic. So the rest of the uterus relative to this, you can see is hypoechoic. This is hyperechoic or echogenic. So this echogenic mass, ladies and gentlemen, is in keeping with a lipoleiomyoma. It's a lipoleiomyoma. So it's a fibroid that is deriving from fat. So it's called a lipoleiomyoma. Is the one that is echogenic, or that has got the configuration that looks like this. So this is a lipoleiomyoma. So let's now come to question number 6. So you can see here in the cervix is a mass that has got hypervascularity. So a hypervascular mass like this, this is a transformation of neovascularization. So when there's a cancer, the cancerous mass, it tends to have more blood supplying it, or it needs a lot of blood supply. So many new vascular channels, they open. So you can see that there's a lot of blood that is going to that. So this is the morphology of neovascularization, which is a cancerous transformation. So this is a malignant lesion. So the one that you're seeing, that's a malignant lesion there. So this is a cancer of the ovary. That's ovarian cancer. That's ovarian cancer. Okay. Now let's do question number 7. So you can see here with the uterus, and in the center of the uterus, you can see there's some free fluid which are inside. This is another pocket of collection of free fluid again in the uterus. So if there's just anechoic free fluid like that, that one that you're seeing there, it is what we now called hydrometria. So water inside the endometrial cavity is called hydrometria. It's hydrometria. So we have got hydrometria there. So if there's also an inflammatory process like endometritis that is happening within the uterus, it causes a collection of free fluid in the endometrial cavity that we call hydrometria. So this is hydrometria. Now we do have good question number 9. So you can see the uterus there, and you can see here there's an echogenic lesion there. There's an echogenic lesion there that is very much elongated. So you can see this is an IUCD. So this is an intrauterine contraceptive device, and the Mirena, that one is in keeping with a displaced. It was supposed to be there in the endometrial cavity up there, but you can see it's in the endocavity. It's in the endometrial cavity. So this is a displaced IUCD located entirely in the cervix. So that's an IUCD that is misplaced or displaced. So, ladies and gentlemen, now let's discuss our last question, which is question number 10. So, what we have here is the uterus, and you can see there is the grapevine appearance in bilateral ovaries this here, and there's some free fluid around the ovary like that. So, this is morphology, ladies and gentlemen, is in keeping with ovarian torsion. So, this is ovarian torsion that is masquerading as a molar pregnancy. It looks like a molar mass. Sorry, it looks like a molar mass. So that is cystic degeneration of the ovaries due to, or secondary to, or is a sequel to ovarian torsion. That's degeneration that happens when there's a torsion. So, ladies and gentlemen, this brings us to the end of our video clip, short video clip based quiz. This is very, very critical, because if you analyze these images like that, you enhance your skill of diagnosis. So don't take this lightly. This is the foundation, this is the fulcrum, this is the pith of medical ultrasound practice. Thank you so much, ladies and gentlemen. Don't forget to subscribe to this channel, and we keep learning. Share with your colleagues as well. Comment and like our videos. Thank you so much.